All right, it's 7 o'clock. I know we're going to have more people coming on board as we get started. Some people may be finishing up, blocking up their store, and that's fine. I did want to, if I can get back to, Laura, what are you seeing on the screen right now?
I can see IPHA COVID-19 Town Hall meeting etiquette.
Okay, good. That's because that's not what I'm seeing, but that's good. At least everyone's seeing what they're supposed to be seeing. Now, how do I see it? Hang on one second.
Sounds good.
There we go. So welcome everyone. It looks like we got about 42 people in right now, and we'll go ahead and get started. I just want to make sure everyone we go through the rules real quick of the town hall. Again, please mute your microphone or your phone. I went ahead and did a courtesy mute of everyone's devices as we go through. Use the Zoom raise your hand function. If you hit participant, you'll see the option to raise your hand if you have a question. If you want to type your question, you can do that in the chat as well. Again, one thing, there's never a silly or stupid question. This is an open town hall. We've got a lot of things changing on a hour-by-hour basis, so please feel free to put anything on the table this evening. And again, this is your time. We want to make sure that we're trying to help facilitate information to you to the best of our ability of what we know right now. And that's going to continue to change. And I do, before we open up the floor, I do want to kind of go through and review some other information with you and more of just web resources that are available to you in addition outside of our communications. So I'm going to switch over to my Chrome. So as you see here on the IPHA page, you'll see we have the COVID-19 banner, but in case, because we've heard from some people that the web banners are not showing up on some phone devices, particularly with iPhone. So we have put in the COVID-19 hot button here on the menu. So wherever you are on the website, you'll be able to navigate to the COVID-19 resources. And we are continuing to update this. I have a list of items that I'm going to be adding on here tonight or tomorrow from both federal and pharmacy resources. So please do continue to look at that. Things change so much, it's hard for us to say, hey, it's changed. So we're just trying to help make sure that we're curating the best resources that we know that are providing the most correct information out there. Just wanted to kind of show you, I'm sure most of you have seen this site on any type of telecast of any of the media reports. This shows the current global cases, and you can select on the United States, and it gives more specific information. And you can actually zoom in like you would with Google Maps and get information about what's going on in Illinois. And it will actually, if you click on any of the dots, it'll tell you detailed information about that area, at least what's been reported by Illinois Department of Public Health. There is actually a more specific Illinois one, and they must be doing some maintenance on it right now. Western Illinois University has been running this, and it does give a little bit more detailed information about top Illinois counties and even cities. So it's just, it's another good information. We'll be linking to it. I think it's a newer resource, and I don't think that they were expecting the traffic that the site is starting to garner. And we may come back to that because now we're still, of course, just after I hit reload, it shows the data. But we'll come back to that one later. This was one that was brought up in the City of Chicago press conferences. It gives a social distancing scorecard for the country. And you can see various states are doing a better job than us, but we're doing a better job than a lot of states. But we fell from being at an A- to a B-. And a lot of that has to do with, we're increasing in the number of cases, which of course is happening because we're having increased testing. But this also gets you down where you can go down and look at your county and how it's being scored. So right now, for an example, Sangamon County is considered a B. And so in 70% change in non-essential visits, again, this is all based off your cell phone data. So if you want to get your paranoid aluminum foil hats on, I'll leave you the rest of that data with how that may make you feel. I do want to spend just a moment to highlight IPHA's new COVID resource and trainings. There are a number of resources here that have been put up as of yesterday or as of late Monday. And Starlin and our current SIUE student Blake were part of a panel of experts that helped put together and edit some of these resources for IPHA. So I do want to recognize that, IPHA is helping you out on a state level, but also providing impactful information on a federal level. And a general reminder about the state has set up its own dedicated website for coronavirus. It's coronavirus.illinois.gov. And this is kind of a good one place curated information for all of, whether it's public health, DFPR, even some of the business resources. And I pulled that page out over here on the side. If you hit resources and go down to business, this has all the stuff about the Illinois Small Business Emergency Loans, Downstate Stabilization Program. And so you can take a look through each of those to find out which one may qualify for your business and how you may go about submitting an application. Just to let you know, those sites are being visited very heavily, so it may take you a number of hours, if not more than a day, to complete an application if you're trying to. In addition to anyone that you may know that's filing unemployment, it's been a very difficult process filing a claim, and hopefully they don't need to call someone because there's barely anyone answering phones at the moment because of how much volume they have. Lastly, I wanted to point out the Illinois Helps program. For those of you who may remember from attending annual meeting 3 years ago, we had a keynote address on public health emergencies and the role of community pharmacy. And this was one of the programs in addition to the Medical Reserve Corps that we talked about. That this is an opportunity, this is basically the database that the state uses when they need to know in Sangamon County, what healthcare provider volunteers do I have that I can ask to do XYZ right now. And so we may be getting special alerts. I've reactivated my profile on here. I know a number of you have stated that you filled out your profile for the first time. They will be doing background checks, so it may take a little bit of time for them to do some of this. I think a lot of it will be just, I know I had to upload a copy of my CPR certificate to the program. So you may need to find some information. You don't have to worry about finding your license. That's going to be coordinated through DFPR. And but I did have to upload a copy of my current CPR certificate. And I see I have a couple of raised hands here. Sorry about that. I'm going to go ahead and activate Dave because he was first. Go ahead, Dave. Or you took your hand down, one or the other. Where'd you go, Dave? All right, Starlin, go ahead.
Hey, all right. So I've got some exciting updated news. Our when they first did the 1135 waivers for CMS, it was only for physicians and nurse practitioners. And through our vigorous letter writing between the diabetes educators and the pharmacy associations, we are now considered auxiliary staff, and we can participate in assisting with the telehealth processes through the physician office for fee for service. So if you are helping, if you're an embedded pharmacist, or you're helping with diabetes education, or if the students are out there working in some of their rotation sites, or like Midwestern has those advocate pharmacists are included, because pharmacists and nurses are now included because we're auxiliary staff. And that they're relaxing that, and that also helps a little bit for the FQHCs. So, and they've relaxed the process that we can talk to patients from our home, and we don't have to be on site at the clinic. So that's a big, that was just yesterday at 5 o'clock. It was confirmed this morning. So on the new telehealth expansion, that's exciting news. So we're not technically named, but we are considered auxiliary staff. So
That's good, and we may have to go back with HFS because they were one of the first states to submit it at 11:35. So I don't know if they need to re-amend anything or not. So hopefully not. So
well, they've got theirs approved, because I read that they have to I think this Medicaid has to designate that auxiliary staff, because I don't know. You're right. I'll give you that. I printed it out and put it on the website for ASHP and ADCES, but I've got that whole packet. I'll send you, Garth, so you can add it.
Thank you. Dave, I think I accidentally muted you and moved you off the list. So I'm going to unmute you now. Here you go.
Okay, I was having trouble with my speaker last night. On the IPHA website where you go into COVID-19,
Yes.
is it possible to make a screenshot of that page of documents and websites and stuff you can get to, and patch that into an email to all the members so that they at least have a gumption and an idea of where they can go to get things? They may not realize all the information that is available to them.
Sure. Yeah, we can do that.
Or
That's a good idea.
dumb it down enough to make it easy for them to, oh, it's right there. I didn't know it was there. Those that are less maybe aggressive on their approach to things.
Okay. Thank you, Dave. I've made a note of that. Thank you. I also wanted to make sure that everyone was aware that we've created some, oops, that did not work. We've also created some graphics for your use during this time. We want to make sure that you are aware of them. We have them up on Facebook. This one is just a basic pharmacy protection measures slide that you can use for general guidance. We also want to make sure that remind patients as things continue to change, especially with the extension of the stay-at-home order, that pharmacies will remain open. Hopefully most of your patients are well aware of that, but in case they aren't, but we're also trying to make sure that they're adhering to your safety procedures. And this is why we put out this graphic yesterday about reinforcing if they have symptoms, they do not belong in the pharmacy at all. In your lobby, I don't care. And I have to agree with one thing I saw today. Somebody said, why are you bringing your children with you? This isn't a field trip. And I think people need to realize they need to start treating pharmacies as they would with the hospital. It's get in, get out. And so again, please utilize any of these graphics. We have made these available for you. If you need them for your sites, please continue to use them to help reinforce the safety for your staff and for your patients. We had a question here. Oh, Starlin was just saying that, yeah, ASHP, Starlin has said that APHA, ASHP, and NCPA are all doing daily updates to their resources. And, you know, and that'll continue as we're all just trying to keep on top of the tidal waves of information that are occurring each and every day. So I do want to open up the floor. That was just a couple of things that I wanted to make sure that we addressed. And if anyone has any questions, again, we've got 45 minutes for your time, and I want to make sure that we allow, there's 56 of you in the room now, so please feel free to raise your hand or state something in the chat, and we'll try to address your questions. And again, if you want to raise your hand, just select a participant, and then you'll be able to see the raise your hand function, or if you want to hit chat to type in your question. Not everyone at once. Ben, I'm going to unmute your line. Go right ahead.
So I was just curious, by the way, can you hear me better than you could last week?
Yes.
Good. Just curious if anybody has heard or if anybody's had any issues at their stores or if anybody's heard any peers across the state of increased burglaries due to this time. I've read about in other forums that people out of work are getting a little antsy and they've had a few extra burglaries during the last week or so. And I'm just curious if we've heard of any across the state.
I have not been made aware of anything, but that is a good point to bring up. Is anyone
Stay vigilant.
on the chat? I think that's one thing, especially now that we're seeing an extended order to the end of April, we will start to see some more community antsiness. I think we've all seen everybody a little bit on edge already. So we'll see how that goes. We had a question on the phone. What are we doing to get the big chains on board with allowing us to close our shutters and just service drive-through? Corporations are not listening to concerns brought up by their pharmacy managers. It is something that we're continuing to work on, not only on a state level, but also on a national level. And one of the biggest issues that we're dealing with right now is that the CDC is still considers pharmacies to be low-risk exposure, and they have not changed that determination. That is causing a major problem with how the states are having to look at pharmacy, not only for regulations, but also for how they approach any type of additional restrictions. Now, that hasn't changed how IPHA looks at our recommendations. We are firm that if you have the capability of using drive-through or delivery or curbside, that needs to be the best way that you're addressing your patients and delivering care. Because right now, the more exposure you have within your pharmacies is more exposure and increased risk to your patients and the rest of your staff. So we are continuing to work with all necessary avenues of trying to get everyone to understand that we need to not lock the pharmacies down, but we need to restrict the access to pharmacies the best way we possibly can. Any other questions or someone? Does the state of Illinois plan for pharmacies to have cap funds by the end of the week? Yes. From my understanding, there wasn't a hiccup with HFS. Not all the pharmacies were applied in the last update that the comptroller pushed out cannabis funds to help expedite the payment of those. From my understanding, HFS has rectified the issue. I was trying to get reconfirmation of that today. I have not heard back from them. And hopefully we will see those funds being applied this week. There's a secondary question also, are there any updates if the Supreme Court is still meeting during this time? No, right now, the Supreme Court is not meeting right now. They actually delayed all of their March arguments. We're not sure how that's going to affect their April calendar at this point. Actually, the only thing that I saw that they're doing there is they're keeping it open so Justice Ginsburg can go to the gym, which to me seems to be a very low priority thing and needs to be reevaluated. Sorry, I know someone's made a comment that I'm breaking up. I'm trying to readjust some of my network allocations here so it hopefully clears up here soon. Is there a clearinghouse at the state or county levels for personal protective equipment? Yes and no. There are state supplies, and of course some counties may have additional supplies of PPE, but again, it goes back to the CDC priorities, and right now pharmacy is considered low risk and not available for PPE. So continue to push on your employers to make sure that you can get access to PPE. We're continuing to push on the department like everybody is, but a lot of it just happens to go down to just the fact there isn't enough to go around. I think a clear example of that is the state of Illinois made an emergency request from the Strategic National Stockpile of, I think it was like 500,000 N95 masks and received surgical masks instead. So we just don't have the resources right now. I know a lot of companies are going other ways of trying to address, 3D printing. I actually heard of a company today that is experimenting and testing a washable and reusable N95 mask. So that's 3D printed. So there's a lot of innovation going on. There's a lot of companies outside of healthcare trying to figure out how to address the issue and try to help us all out. We're continuing to work with any of the wholesalers, trying to make sure we can free up any resources to be available to pharmacies. And everything is being prioritized right now to the hospitals, especially in the high epicenter cases right now. And hopefully we will see, I'm hoping we can get some relief on PPE here pretty quickly. Gary Moreland, you've got your hand raised, and it's not giving me the option to unmute you, so you may have to unmute yourself, Gary. Is there an initiative for donations to IPHA or alternative that could be dispensed to pharmacies and staff? That is a good question. IPHA, specifically through the IPHA Foundation, we would not have any problem with receiving any donations of supplies and be glad to work with pharmacies and getting that out to everyone. I know some schools may be looking at this as well. Not that I'm saying it's the only school. I know Midwestern specifically, I just happened to see it on social media, has been gathering a lot of supplies and making and donating them out. So if any of the other schools that may be on the line, I know there's some representatives of other schools. If you know of any programs that you're doing right now, feel free to raise your hand or say something in the chat, and we'll be glad to share that with you. But if anyone has any supplies, that we'll be glad to take those through the IPHA Foundation and work with pharmacies and getting that out. Any other questions or anyone who wants to raise their hand? There's another question. Laura's got one. Do we know if community pharmacies will have access to the Abbott COVID test? I know that they are working with some chains that may have national access to be able to disperse the tests within their communities. I think Abbott is just trying to look at all avenues that are possible. If there's any pharmacists, I know we've have a couple of pharmacists and a couple of them that are members that are with some of the experimental pilot teams up in Chicago. And I know Walmart's got one, and I know Walgreens has one. So if anyone's from those teams that's available to kind of talk about how their progress is with that, we'll be open to that. But before we go there, Gary Warland, I think your microphone is unmuted, so go right ahead. Gary, I'm showing you as unmuted, but you may still be muted on your phone. Oh, now you're muted. Now you're unmuted. Go ahead. Well, we'll come back to Gary. We have someone who's listed here as iPhone, so I'm going to go ahead and unmute you. But if you could identify yourself, please, for the group.
Hi, my name is Lisa. How are you?
Pretty well, Lisa. Thank you very much for joining.
Thank you. I am currently in the community space, and I'm working on a pilot team, and I've been doing COVID testing for the last 2.5 weeks.
Excellent. How's your experience been with the testing so far?
So the testing is quite involved in terms of the PPE that is required. So there are very specific steps that have to be followed. There's going to be an outlay in terms of PPE. You need shoe covers, you need gloves, a respirator, goggles, and if not goggles, a face shield and an apron. So there's an outlay in terms of the supplies that you need for the testing. There are 2 types of testing that can be done. The oral testing, which is the oral, the swab goes into the back of the throat. And then there's the nasopharyngeal test, which there's a swab that's inserted into the nose. And we're doing the nasopharyngeal swabbing with our pilot testing. And there is an art to that. Typically, it is not a comfortable test because you're having a swab that feels like it's kind of coming through your brain or either through your eye. So a lot of patients that we've tested typically either want to cough or sneeze. So you kind of want to stay away from that because if they cough or sneeze, there's a lot more PPE that you have to get rid of after each patient. So the testing is involved. You have to get, also one of the things before you start is you have to get fit tested for a respirator. So that is required for the training to do COVID testing. And men cannot have beards to do COVID testing. So that's something, that was an interesting tidbit that I didn't know. So you have to be clean shaven to get fit tested for the respirator. But the good news is that pharmacists are really at the forefront of this testing. We can be easily trained, and it just dovetails very nicely into all of the things that we've been discussing over the last many years about expanding our scope and and how important of a role that we play in the healthcare system. And particularly for a pandemic, all of the hospitals are overwhelmed. So the pharmacists are the next, line of defense in terms of dealing with something like this. So this is really great, for pharmacists, I feel. I've been very proud to be a part of this pilot team. The testing can be done, the training can be done quickly. It can be something that can be handled probably in a day or half a day. So that's the good news, is that this is something that pharmacists can do and get ramped up quickly. And it just fits really nicely into all of the things that we love to do in terms of our clinical services. So it's been a great experience. And in terms of the pilot testing, we initially focused on first responders and healthcare workers. And it was just so rewarding because all of the people that were tested were so very grateful, and they just could not thank, they were just saying, thank you for doing this. This is great. And so the platform for pharmacists in this space is great. And I think we should leverage that and really, really show that these are the things that pharmacists can do, and we have been doing, and we're great at doing. And it just underscores the need to have all the things that we've been asking for in terms of, our provider status and expanding our scope of practice. So in a nutshell, I'm very proud to be able to help our country in this way. And that's it.
There we go. Sorry about that. Lisa, I was saying, congratulations to you. You're really doing a lot of great trailblazing and helping show that pharmacists can do this adequately, repeatedly, and safely. And about how many tests do you guys think you're doing through a normal shift?
Well, in terms of the testing that we're doing now, the maximum number of tests that we could conduct in the testing hours are typically from 9 a.m. to 4 p.m. And initially our flow, we had to get the flow down. So there's a lot of steps and there's a lot of coordination. But because we've been doing it for over 2.5 weeks now, we have 5 pharmacists that are doing the swabbing, and every pharmacist has what we call like a runner, because we have to do the testing in people's cars. They can't get out of the car. Right. So for our testing site, we've gotten so good that we can get about 40 swabs done in an hour.
Wow.
So
that's impressive.
Yeah, so we've been, we initially weren't that good, but now we're really good. So, we've gotten it down now. So about 40 swabs per hour. But this is involved. You have to, you have to take people's administrative information, name, and date of birth, and then we're giving them like an information sheet on COVID and just resources for them, because that's what we do as pharmacists, right? Inform and educate. So it's an involved process, but the more you do it, the better you are at it. Just like, when we first started doing immunizations, that used to take a while. And then, before you know it, you can do an immunization in no time.
Are you using any students or technicians to help out with some of the administrative components?
No.
Okay.
No. Not at this time.
Okay. Well, Lisa, we'll let you go back on mute, and we greatly appreciate all your information, and thank you very much for what you're doing.
Oh, sure. Thank you, Garth. Thank you so much.
No problem. We had a couple of quick questions through here, so I'm going to try to go through those. Can pharmacists get equipped in PPE materials to do this for the testing? That's going to be the long-term question, because there's a lot of movement nationally, and part of our recommendations to the governor's office was to allow pharmacists and student pharmacists, and actually even technicians, to be able to do this test. But again, it doesn't help if we can get the test if we don't have the ways of protecting ourselves. So we have to have both parts of it for us to be able to do this. A question, there is a small business administration loan program that would benefit community pharmacy. Yes. It is the economic injury disaster loan. It does take about 10 minutes to fill out, but I know that we do have the link to that in our COVID-19 resources. Thank you very much for pointing that out. And there's also an Illinois version of for economic disaster programming as well. That one takes a little bit longer to fill out. So please do go to our resource page at ipha.org/COVID-19, or you can hit the COVID-19 button. Are most pharmacists in the area not already point of care certified? If not, how can we rectify this? Right now, a lot of pharmacists may not have completed the NACDS certificate for point of care testing. IPHA is actually a licensed partner for this program. And just because it's hard to get some of the supplies, and right now it'd be, let's just be honest, impossible to get some of the supplies to do the test. So we're recommending that pharmacists would be trained on site, and probably a lot of the ways that Lisa and some of her fellow pharmacists were trained to and have someone just sign off on it right now instead of going through a certification program. Lisa, in case you didn't see it, there's a lot of people congratulating on what you're doing and giving you standing ovations. Lisa, there was one quick question. Laura had a good question. How long do you know is it for the results to come back from the test that you're administering?
Okay, so can you hear me?
We can go right ahead.
Okay, I'm sorry. I'm not so tech savvy, so thanks for my claps and standing ovations.
You're doing fine.
As far as the results, so what we're telling people is it can typically 5 days. We do know that there's a little backup, so it may not be as quick as 5 days. And there's a phone number that we are giving people. So if they don't get a phone call within 5 days, then we are just asking them to proactively call that number to try to get more information. So I think, there's just a lot of strain on the system right now, a lot of, tests being run. So it's not turning around as quickly for some people but we're saying 5 days, so.
Okay.
5 days.
Thank you very much.
Sure.
Gary Moreland was able to type in his question here. We have, he was wondering, how are all handling employees whose family members are presumed positive, quote, not tested, of course, but remain asymptomatic? Would anyone would like to address how they're handling that? Because my response would be, we've seen a lot of different models and how businesses are handling that. And if some of you have been involved with different policies and protocols, if you can see if you can chime in here on that. And someone had a question to Lisa, who's funding your pilot program? And Lisa, you can correct me if I'm wrong, but I'm not mistaken. It's being done by the federal government, if I'm not mistaken.
Yes.
So anyone want to talk and address the with how you're handling if you happen to have any staff who become presumed positive through either exposure, and what you're doing with that? With some of the guidelines that we have seen, you can kind of go one extreme or the other. You can go the full extreme of having them remain off-site until that person is cleared, which could mean that you have someone in self-isolation for up to 7 days, which means that they're not available for your staff. Some places are actually having people come in with masks on and having them wash their hands at about every 20 to 30 minutes. So it all depends on how you're wanting to entertain that risk in your practice, and again, to your patients. I would suggest, if you have anyone who may be presumed positive or a family member, that you call your county and local health department to be able to address what their current guidance is at the moment. Because as we said, a lot of this has changed. Remember, we were talking self-isolation for 14 days last week, and that's changed now to 7 days. So we're learning more and more about the coronavirus as COVID-19 is going through. And Ben, I'm going to go ahead and unmute you.
So one thing that we've learned sort of related to this, our accountant called us on Saturday to talk about some things that he's learned in regards to if you send an employee home or if they have to leave because they are presumed positive or are showing symptoms and you are sending them home because they cannot work because of the virus. There are some laws now that are saying that we have to provide up to 2 weeks of pay for those employees. And some of the instructions that he has found is that this money that we pay should be reimbursed back next tax season in some sort of tax rebate. So they'll kind of give us that money back. But we don't exactly know how that's going to work yet. And his fear is that the specific guidelines have not been finalized. So sometime a month down the road, they may come back and say, here's the exemptions to this or the extra restrictions that you either don't qualify for that money or you were supposed to do this or that. So it's kind of an uneasy situation right now in understanding how to navigate those waters. But it's something I would advise everybody to talk to your accountant about if you do have one of those employees you have to send home.
Thank you, Ben. Does anyone else have any information that they would like to share? Starla saying CARE Act details, that's still something that we're hoping to get a good summary document of. Some of the national associations do have some documentation. There's a lot of questions out there right now about what applies to who. All the way down from small businesses to nonprofits and foundations. So it's just, there's so many unanswered questions, and right now what we're hearing specifically about the loan process, we were hearing that it was going to be pretty quick and automatic and online, and that may be rapidly changing to a very long, strenuous manual process. Because of course, the banking institutions want to make sure that, things are covered. So, it may end up being a lot longer of a process getting money out, just like we're seeing with these checks for individuals. They kept saying, oh, they're going to be out really quick, and then it was going to be 3 weeks. Well, I think 3 weeks is next week. And so I think there's still, this process is not going to be as quick as that the behemoth that is the federal government wants this to roll out. Yes, thank you for the question on the CARES Act, and thank you, Starlin, for kind of going through some of the summary information. I'm trying to get to it. Is there any other questions or comments that anyone has at this point?
Hi, Garth. It's Lisa.
Yeah, go for it.
Just to kind of jump in on how some companies are handling employees. So in terms of if there's in my experience, kind of the experience that I have with the company that I work for, if an associate feels like they are exposed, but they're not showing any symptoms or signs, basically they want them to, come. If they start to have any signs, then that would be a reason to self-isolate or self-quarantine. I literally today had a situation where a pharmacist came she was working at the beginning of the week at a pharmacy location, but she already was concerned about being exposed because she has an elderly parent. So she had a mask on. She did have an N95 mask, and she had on gloves. And that was Monday. And today she started to have symptoms of being sick. So thank goodness she had on a mask and gloves. And I think she already kind of felt like maybe she was at a higher risk and she wanted to just be as cautious as she could. So, everybody's kind of handling it differently based on, the company and the situation. But yeah, so that's kind of where it is. And then as far as there are steps in place. So if an associate feels like they don't want to come because they're afraid or they just don't want to be exposed, then they can request the 14-day self-quarantine. But the issue is, like, say if they do that and then they don't get sick, but let's say they get sick maybe a month from now or 2 weeks from now, then they can't basically file a claim twice. So if they file a claim for self-isolation and they're not really sick, if they really do get sick at a later time, that time would have to come out of like their own personal time.
Mm.
So it wouldn't be like a separate claim that they would be entitled to for the first self-quarantine. Does that make sense?
It does, but
okay.
This needs to be stressed back to employers. This is not a time to be pinching sick day time.
Yeah.
You need to be looking at the impact on public health and the impact on the rest of your teams.
Absolutely.
But I appreciate the feedback on what your company is doing.
Yeah, well, they are. We're going to have sneeze guards installed.
Oh, good.
And so we definitely are going. The company is working really hard to make that happen. So we're going to have sneeze guards installed, and then now associates are going to be able to wear masks and gloves if they want. So.
Thank you very much. Just because I was able to get it pulled up, I do want to go right back over to one of the resources real quick. I finally got this Illinois map to populate more. So like I said, it's showing the total number of cases, the number of deaths, and then it shows the top 10 counties, and then compared to the top 10 counties in the United States. And then it shows pretty much these numbers are almost identical to what's on the state public health site, but it's nice just to have yet another resource with different analytics to take a look at. Warren, I'm coming over to you. You should be unmuted. Well, let me try it again.
Hit the unmute.
There we go.
Okay, thank you. Good meeting, guards. There are 5 federal prisons in Illinois, and all of them are on lockdown, as well as the others across the country. I've now worked in 13 of the federal prisons from one coast to another, and this has never happened. When the prison goes on lockdown, in this case, it's for 2 weeks. If there are any positive inmates with a positive coronavirus, if they have to put into isolation because of their symptoms, every federal prison has a certain number of ICU spaces. But if this virus would sweep down the hallway of a prison, it would overwhelm the ICU units. Yes, the inmates can be moved to community hospitals. That would be a big burden on any community, in my opinion, because those inmates have to be in a secure room and there have to be guards 24 hours a day. So the worst case scenario would be if it spreads and then they have to be moved to the local area or community hospitals. So keep track of what's going on through bop.gov. Garth and I looked at it, I believe, today. Each day they give an update of the prisons in the United States where there have been positive inmates with positive tests and employees with positive tests. I'm fortunately not one of those positive test employees. So that's something to watch, the bop.gov, and where any outbreaks are across the country. And I would suggest you do that certainly weekly. So thank you, Garth.
No problem.
First
Thank you,
time I've
Warren.
used your system, so pardon me if I'm a novice.
No, you did perfect. Thank you. And thank you, Warren, for your service in the Bureau of Prisons. And I think we all know that there's also issues right now on the state prison level as well. The National Guard has actually sent in some of its own medical officers into Statesville to help with the Department of Public Health right now, trying to get Statesville under control. So we do have a continued issue in the correction system because with it being such a very tight and closed system, moving the inmates from back and forth to court, and also with the employees still going home and coming back to work, are exposing within the enclosed system. We've got just a couple minutes left for any last minute comments or questions. And just as a reminder, we are going to continue to hold these weekly, at least for the time being. We're hoping to start the town halls with a short CE 15-minute topic related to COVID, just so we can kind of try to give you a little bit more up-to-date information and give you some CE credit along with this. So please work with us as we continue to get that all set up for everyone. And we hope to have a topic for you, hopefully for next week's town hall. But again, we're going to continue to hold these every week. Any other questions or comments? Go ahead, Ben.
Just to piggyback off of what you just said about holding these every week, all the people who are on this town hall should reach out to their peers that may have not gotten the email or heard about it, because I'm sure there's a lot out there that would like to be on these town halls that may have not gotten the email. So tell all your friends, because this is great info. And thank you, Garth, for putting this together and getting all the info out to all the membership. You've done a great job.
Thank you. And I'm hoping our recording holds this week. We'll be able to see shortly after we record. It was unfortunate, but we lost the recording for last week. Laura also put on here, when you FaceTime with your colleagues, send them to our website to become friends. So don't be afraid to screen share to join up to the association. I really want to thank everyone again for taking time out. I know we're all stretched a little thin right now, and we'll get through this as a team, as we always have, and we're going to serve Illinois the best way we possibly can. So thank you, everyone. Have a great night.